Hi, I'm Susan Barth, and I'm the founder and the president of the nonprofit Together in Happiness. And I want to welcome the participants today. Those of you that have been to our previous webinars, welcome. And for those coming for the first time, a big welcome. And of course, a huge welcome to our guest presenter, Dr. Barbara Gordon-Cohen. Now, before I introduce her, I just want to share a few words about our nonprofit for those of you that haven't met us yet. We were founded in 2011 as a resource center promoting the awareness, the recognition, and the advocacy of the critical importance of marriage education, marriage enrichment, and coaches. And we serve Jewish couples in Israel and in English-speaking countries, regardless of the stage, from engaged to those married 60 years. Now, marriage education, for those that aren't familiar, it's not therapy. It teaches the skills that are associated with happily married couples. And we focus on providing education, empowerment in the areas of enhanced communication, problem solving, conflict resolution, expectations, and also how to manage those arguments so that you can learn to talk without fighting. Who does it benefit? Everyone in society, because again, it's teaching skills. And we go from engaged couples, newlyweds, expecting, married couples, but also partners, parents, grandparents, rabbis, government agencies. We try to address all stages, but most of all, it comes down to the couple. Why? Because the couple is the nuclear unit. And the skills that we provide are foundational skills, those that will help deter potentials for divorce and instead focus on strengths and how couples can bond together and bridge transitions. We provide the benefits to the benchmarks to the behaviors so that you can know what to anticipate through the different cycles. But of course, the idea is that the couple is part of a family unit, and the family of origin was the first beginnings that a couple saw as individuals. And a healthy family is good for the economy, it's good for health, it's good for the entire country. And that's essentially what we hope. We provide the skills so that it reverberates from the couple to the family to the society. And that is why this particular webinar is something I personally have been looking forward to for a very long time. The privilege that I have is to have met our guest presenter, Dr. Barbara Gordon-Cohen, as my own doctor. I was suffering from the things that she's going to mention in terms of pain for years. And I had the good fortune to go to her office, and she not only examined me, but also introduced me to Dr. Sarno's methodology. And it was an instant gift from heaven. So that when she consented to do this webinar, it was really something that I know all of you will benefit from. So that's why grab your pen and paper and take good notes. And I want to formally introduce Dr. Barbara Gordon-Cohen, who is an osteopathic physician focusing on family medicine, integrative medicine, and on the cause of imbalance and not just the symptoms. And so without further ado, thank you for joining us, Dr. Gordon-Cohen.
It's my pleasure. I'm happy to talk today about Dr. Sarno, which I'm very passionate about his work. And I had the privilege of spending 3 days with him. And I'll tell you about that in a few minutes. I will give you a little introduction of myself and why I got into Dr. Sarno. I think all of us, including Dr. Sarno himself, got into this whole concept because we ourselves had different symptoms that were not getting relief with conventional treatments, conventional medical, or even alternative treatments. So whether it was a regular conventional physical therapy and injections, acupuncture, homeopathy, nothing was working for them. And this did the trick. So for me, just a little background on myself. Before going to medical school, I was a very young, active child who grew up in a house that my mom was away a lot. She worked 1 or 2 jobs, loved working, wasn't the most nurturing person in the world, but a wonderful woman, but with her limitations, like all of us have parents with limitations. And I guess didn't get the quote nurturing that I needed. I dealt with it by keeping myself very, very busy. I was very active. I was a gymnast, competitive gymnast. I was a competitive diver and a competitive swimmer. So already Dr. Sarno talks about there are three areas that a person usually have. There are three areas that people go along with the Sarno. One is that they are, we call it goodism. They want to look good in society. Okay, being a gymnast, you want to get that 10, you want to get the perfect score. Being a perfectionist, being hard on oneself. And I know in the Orthodox Jewish community, we have all these mitzvot that we keep. And that alone, there's a lot of pressure on us to keep these mitzvahs and to do the right thing and to do good. And we're productive people. And by nature, we're hard on ourselves. I was very hard on myself. And then after gymnastics and so on, I was pre-med in college and competing. And then from there, it went to going to residency, having two babies in my residency. And then from there, raising a total of 5 children. I was the breadwinner of the family. I felt resentful that I had to work so hard that my husband wasn't able to provide. So there was a lot of pressure on me to work. So my consciousness, and this is what Dr. Sarno was about, basically. I'm going to go from me to him. Dr. Sarno's theory really is about just your ego or your consciousness wants to do good and wants to be good. And then you have this unconsciousness or the id, which is narcissistic, which wants pleasure, wants to do all kinds of fun things, doesn't want to follow the structure, doesn't want to be good. So you have this battle between ego and id, or between consciousness and unconsciousness. And the unconsciousness is so painful that what we do, our body, what it does is it diverts our unconscious rage or feelings. It could be rage, it could be fear, it could be guilt and shame, any emotion really. But there's a lot of them in the unconsciousness, and it's too painful to express. So the body diverts itself from the psychological place to having physical pain. And how does that happen? When you're battling, literally, like when you're in a battle, your nervous system goes into fight and flight. And when it goes into fight and flight, the blood vessels constrict, they get small. And it goes to a place, a vulnerable area, wherever it may decide to go. It will go to an area and because the blood vessels are constricted, then you're not getting oxygen to an area. And if you don't get oxygen to an area, say the low back, you're not getting the oxygen you need to the area, you can get pain, numbness, tingling, weakness in the extremities, even to the point of having a foot drop. It could be that bad. It could be so debilitating that you're literally lying on your back and you can't move. That's how debilitating it is. The low back muscles are big muscles. It could be in the form of tendonitis, so rotator cuff tendonitis, or the elbow, epicondylitis, tennis elbow, or golfer's elbow. It could be in the form of neck pain with radiating pain down the arm and tingling and numbness. So we have all these different conditions. Also, it could be other conditions that are not life-threatening, like asthma, allergies, reflux, ulcers, irritable bowel syndrome. These are all migraines. These are all conditions that are not life-threatening, but they're real and they're painful and they are very limiting, and it can stop you in your tracks. So for me personally, I got to a place when I was 37 that there was a lot of stress on me financially, with my children, pressure in the business, a lot of pressure. And I got to a place where I was having severe pain in my forearms, terrible pain, both forearms. And I wasn't sleeping well, and it really affected my whole nervous system. I wasn't sleeping. I was hot. I had heat coming out of my head. I was putting ice packs on my neck, sleeping in the dark. I was really sensitive to sound and light. It was really like pervasive. And I had to stop and I had to go for therapy. And I did all kinds of other work, breath work and yoga and homeopathy and acupuncture. And all of it did stop me in my tracks, and my pushing as a young child to keep going and being so productive came from a place of fear. So my unconsciousness was very fearful and frightened because I came from a very, what would you say, a very chaotic environment, financial chaos. My mother was always yelling at my father about money. So it was just very chaotic and very unsafe. And I said, as a young girl, I'm going to be a doctor, I'm going to help people. But it came from a place, not from the right place. It came from a place of, I'm going to not have to depend on anyone. I don't want to be in this unsafe place anymore. I'm going to make something of myself. And I just blocked everything out and I studied. That was my mechanism, which worked at the time, but then it didn't work later. And I had to deal with it. I had to face it. God made me face the situation and come to a place of feeling these emotions. And for some people, they have to go back to childhood. And Dr. Sarno would say to some of his patients, because when he did his exam, he would evaluate patients. And in the exam, he would ask about their childhood. And if they had a difficult childhood, it could be trauma, emotional, physical, but it could also be just feeling unsafe or neglect, which sometimes is worse than abuse. So he would go there with every patient. And if he saw that there was childhood issues, he would say, you need to seek a psychoanalytical therapist or a therapist that's going to work with you on your childhood and unravel all of these emotions that are hidden, that are blocked, that have never been expressed to get to the root cause of your pain. But there are some people with Dr. Sarno that completely get better with just acknowledging what their frustrations are, acknowledging what emotions they have. He calls it unconscious rage. So whatever you're frustrated at, big or small, it could be like you don't like waiting online in the supermarket. You can't stand when somebody puts the cart in front of you, goes shopping, and then comes back and says he or she is before you. That's so frustrating. And you're just sucking it up. You're not expressing it. It could be little things like you don't like your husband's toothbrush next to your toothbrush. It could really be little things. I've seen it with little things and I've seen it with big things. So Dr. Sarno, how he got involved was in the 1970s, early 1970s, he himself, so all of us, I think, who got involved with Dr. Sarno, all of us have had symptoms ourselves and then got into this work. And it led us sometimes, some of us into deeper work, and some of us just needed to stay right here, right with Dr. Sarno. Dr. Sarno would first evaluate the patient. I had the privilege to spend a week with him at Rusk Institute. He practiced in New York City at Rusk Institute, and he was the director in the physiatry or rehab center of Rusk Institute. And in the 70s, he saw people with, most of his patients had chronic pain. And he was frustrated because he saw that half of them weren't getting better with the standard physical therapy, standard injections, standard TENS machines and ultrasounds. It wasn't helping them. And he himself suffered from migraines, and he had a friend who was a psychotherapist. And the friend said, why don't you start writing down what's making you frustrated and angry? And I bet you have a lot of unconscious emotions that haven't been expressed. I bet you if you start writing them down, your migraines will get better. And he'll get tension headaches as well, which are like headaches that are worse at the end of the day. So sure enough, that's what he did, and he got better. And so between seeing his patients half his patients not getting better, not getting results with the standard treatment, and his own pain, then he started to develop his own research into this. And he saw too that people would come in, they had completely normal x-rays and MRIs, and they had chronic pain. And then he saw people who had no pain at all in a particular area. So say they did an MRI of the cervical and lumbar spine, and the person's complaining of neck pain, and they also did the lumbar spine for whatever reason. And he saw these people, some of them, had no pain, and they had significant findings on MRI. Now you have to know that an MRI is a serious issue when it comes to disc herniations that are literally pressing on the spinal cord. That is an emergency, and that needs to be dealt with the neurosurgeon. So all the standard medical diagnoses and treatments have to be ruled out first. And then once that is ruled out, then you can move on to say, okay, this isn't working for me. I'm going to move on to Dr. Sarno's protocol. And I've had so many patients get better with this protocol. It's countless. And it's just so amazing because they go from a pain of 10 to a pain of 0. And it could be within a day, it could be within 3 months. Some people take a year, but they stay with it, and that's what we're going to talk about, how it works next. They stay with it, they're going to get there. If they treat it as it's like the Bible for them, they treat it like seriously, they're going to get better. Now, Dr. Sarno, in his physical exams, he would first ask what's going on with you, how long has it been, was there any stressors involved? And sometimes they're in denial. Many patients could be in denial that there's no stress at all. And then he would go into their medical history, he'd go into their childhood history, and then he would always look at the x-rays and the MRIs. Actually, he would do that before he even saw the patient to see if they were a candidate or not. And the next thing he would do is he would press on certain points in the body. And everyone who is a candidate for Dr. Sarno, like I said, they're lacking oxygen to certain areas because of this fight and flight going on. And there are certain areas that would be tender to touch, and he would palpate. He'd have you lie on your stomach, and he would palpate the top of the neck where the neck and the head meet, and that would usually be painful. And then the sides of the neck also, the scalene muscles, and that would usually be painful. And then he would press on the trapezius muscles, which is like, let's see if I can get there. Okay, between the shoulder and the neck, the trapezius muscle. It's a big muscle, and it's like you have the weight of the world on these muscles, the trapezius muscle. So if you're one of those real responsible people who are responsible for your children, your parents, in your job, and you just carry all this responsibility, a lot of times people will end up with pain in this area. And then the low back, the quadratus lumborum muscles, so that's the low back muscles. If there's pain, to touch there. The buttock muscles or the piriformis muscle is a big point. A lot of people get sciatica for sure. Most of them, it's coming from this unconscious rage. There are some who have sciatica because of a disc herniation. But again, disc herniations don't really mean anything unless, again, they're pressing on the cord. And the reason why is because the muscles, when they're so tight, they can start pulling on the disc. And when you start doing this work, the muscles start relaxing, the disc starts to pull back in and not protrude, and the herniation starts to improve, etc. And you can have herniations without any symptoms. So it's an interesting scenario. And then besides the buttock, the next is the iliotibial band, which are the side of the legs between the hip joints and the knee. He would press on those muscles. And again, if they were tender, he would say, okay, with my history here, you're hard on yourself, you're a people pleaser, and you're a perfectionist. You don't have to be all three. The biggest one, or the important one, is hard on yourself, putting pressure on yourself. And he also calls it goodism, the need to want to be good and do the right thing. That person, and most of us are like that, especially Jewish people, are very into doing the right thing and just going overboard and being really active and really responsible. And unconsciously, we're like, I want to play, I want to have a good time, I don't want to work so hard, etc., etc. And that battle is the problem. So he would do that. And then after all of that, between physical and his history, he would give an 1.5-hour lecture. And you can get that lecture online. If you Google Dr. Sarno lecture methodology, you will see his lecture. And it's a good hour lecture. And he talks about why this happens and the pathophysiology of it, which I'm pretty much talking about now. And he talks about it in his lecture. He's written many books on the topic, and I will give you the names of the books right now. One is Healing Back Pain, which is a nice, easy read. If you have back pain, it's a nice, easy read. The Mind-Body Prescription, which is Healing the Body, Healing the Pain. That's an excellent one for anything, like not just back pain, any condition or any pain. The Divided Mind, which is all the other books I had and I gave them away, and now I don't have them anymore. That's what happens when you give books away. This is The Divided Mind. This is his last one, and I'll move it over here. It's very thorough. I'm enjoying it very much. He really goes more into the psychology, talks about Jung and Freud, and it's a very thorough book. And You could just read this stuff over and over. And then the other one that I would recommend if you're into, this is an excellent book by a patient of his, and it's called The Great Pain Deception. And it's by Stephen Orzinich, a patient who suffered severe low back pain that he was literally on the floor on his back for a year. He did not leave his apartment. He couldn't leave. And with Dr. Sarno, he ended up literally opening his door and crawling out of the house, crawling on the street, and then eventually walking and eventually running and getting better. So it's a great book. I really enjoyed that book. I could put it down. And there's another physician, Dr. David Schechter. David Schechter wrote, this is really a great book. It's called The Mind Body Workbook. It's a 30-day program as far as writing down, which Dr. Sarno, once he has you do the lecture, Dr. Sarno wants you to read about 20 minutes a day and write about 10 to 20 minutes a day, spending no more than 40 minutes a day doing this work. And basically, this is great because it's really organized, and each day you have a different homework assignment. You don't have to do this. You can also, I tell my patients to, if they should write because it's permanent. When you write, it's permanent. You could rip it up after, but it's like your brain, your nervous system is like pulling it out into the physical place. So it's a good thing to write. And what I tell my patient is just divide the pages or different pages, one for your family, your children, your husband, finances, the place that you live in your community, friends, and miscellaneous. Is there anything else? Parents. So most of our stressors are all within those. And the deeper you go and the more specific you are, the better off you are. And it could be one thing. Like I was working with a patient. I did Zoom with her, actually. I was working with a patient, and we did have to go back to her childhood because she was raised by one parent and the other one left. And she was like, she had to be like the mother in a sense as a child. So she was like very responsible as a young girl. But it took a while to get to the place. And the place was that her husband cheated on her. And she found out by looking at his email. He was away in another country. And she mentioned it to him. And he said to her, "Yes, it's over. And I'm sorry. And I don't want to talk about it." And she just said, "Okay." And she never expressed her feelings about her hurt and her pain. And she just kept going. And just like you said, he didn't want to talk about it. So she was a good girl. I'm not going to talk about it. Fine. But she was in aggravating pain in her low back, her sacrum. She told the surgeon, "Please, there's got to be something wrong with me. I can't take it anymore. And I have to work. And I have two babies. And please just do surgery." She was like so desperate. And that was it. Once she wrote a letter to him, I don't know if she ripped it up. I think she ripped it up. But once she wrote everything down, what her feelings were, that was the end of the pain, gone. It's just amazing stuff. And sometimes like it could take months to get to that place. And sometimes it could just take days even to even just recognize and acknowledge that you are hard on yourself and a people pleaser, and you're fighting with your unconsciousness because your consciousness is always trying to be good. And I wrote a book called Bridging the Gap to Oneness. I wrote this in, I think 2000, I don't even know, 2018, I think it was, maybe something like that. And this is my guide. It's like my healing journey. So throughout the book is my journey of healing. But in it, each chapter talks about homeopathy, acupuncture, mindfulness, meditation, yoga, different types of therapies, breath work, what else? And Sarno, Dr. Sarno, and even deeper work, something called The Journey by Brandon Bays, where you're literally dialoguing with your parents and saying all the things that you never had a chance to say. And that was really a powerful work too, but that's going again into childhood, which again, many people don't have it's not about their childhood. It's about what's going on like now, here and now. So that was that. Now, what I want to do is go on to a questionnaire for all of you. How many people here suffer or suffered from chronic pain? This is a questionnaire that is actually from David, and his book is called Think Away Your Pain. And like I said, the workbook, the Mind Body Workbook, is his workbook if you need structure with writing. So Think Away Your Pain is a very organized book on Sarno. He himself was in medical school and suffered knee pain, and the x-rays were normal, and he had physical therapy. Nothing was working. And nothing at all was working for him. He was doing all the exercise that was told to him. And you could also write in the question and answer part in the chat, in the question answer, you can write down if you have pain, if you had pain or you have chronic pain. Anyways, Dr. Schechter had knee pain. Nothing was getting better. He was in medical school and he liked to play basketball and run, and he couldn't. So Dr. Sarno had lectured at his school and he remembered his lecture and he decided he's going to call Dr. Sarno. And he did. He made an appointment. He did the work and he got better. And then he himself now has a practice in California. He's a rehab doctor, physiatrist, and he has a clinic that was very much supported by Dr. Sarno, who, since he was in California, Dr. Sarno used to refer patients to him in California. The questionnaire, here we go. So you have your pen and paper. I'm going to ask you a few questions. And then at the end, if you score greater than 7 to 10, it's most probable that you have, we call it TMS, tension myositis. That's what he calls people with chronic pain coming from lack of oxygen and causing significant muscle pain, weakness, numbness, and tingling. Okay, so here we go. We're going to go question number 1. Have you noticed a relationship between your pain and your emotional state and stress level just prior to the onset of your pain? So 2 would be definitely, 1 would be sometimes, and 0 is not really. That's question number 1. Question number 2, would you describe yourself in general as being very hard on yourself, highly responsible for others, very thorough, orderly, or a perfectionist? So definitely is 2 points. And 1 point would be, I've noticed some of these characteristics, and not really is 0. Number 3, have you suffered from other tension-related illnesses, such as hives, eczemas, rashes brought about by tension, spastic colon, irritable bowel, gastritis, reflux, heartburn, tension or migraine headaches, unexplained prostate trouble, or pelvic pain? Again, unexplained. So we had them work up and nothing showing. Okay, next, so that question is number 3. So again, 2 points would be that it's all the time, 1 point is some of the time, and 0 is not at all. Okay, the next one, 4. Oh, also with the question that I just said, also you can add TMJ, teeth grinding, plantar warts. Believe it or not, plantar warts. Okay, number 4, have you been told regarding the cause of your pain that there's nothing that can be done surgically? There's nothing wrong. It's a soft tissue problem, or that the cause is degenerative changes. So yes is 1 point and no is 0. Number 5, do you spend a fair amount of time during the day thinking and worrying about your pain, researching an answer and obsessing about its cause? Yes is 1, no is 0. Number 6, have you tried several different treatments or approaches for your pain and received only temporary or limited relief from each of them? Yes is 1 point, no is 0. And last but not least, well, there's 2 more. 7, do you find that massage helps your pain significantly, or that you are quite sensitive to massage in several parts of your back or neck? So when you get massage, it hurts in a lot of places, or that it gives you some relief, but then you're back in pain. Why is that? Because massage is increasing oxygen to the area, so you get relief. Some people get relief and then it comes back. So yes is 1 and no is 0. And okay, and then the last one is, does the pain ever move to another location in your body or jump around? So it's 1 day neck, 1 day it's back, or you've had low back pain for 1.5 years, that got better, and now you have neck pain. So it just goes from place to place. Okay, 9, have you noticed the pain improve when you've, so number 8 is yes or no, okay? And 9, have you noticed the pain improve when you have another tension-related illness? So say you have a sore throat and you notice my pain is gone, or whatever it is, something else. You have TMJ and now your low back pain is improved. And 10, has the pain significantly changed or gone away while on vacation, away from home, or while distracted? Yes or no? Okay, so when you add up all your points, it should be less than 7. So 7 to 10 is most probable that you have this TMS. You're a Dr. Sarno candidate. And 4 to 6 is possible, and 0 to 3 is not, probably not. So that is a great indicator for you to do a mental search as to who you are, what you are, why are you having the pain? Is it from this type of personality, the hard on yourself, people pleaser, or want to be good or perfectionist? Again, you can be a perfectionist and you don't have to be a perfectionist and you don't have to be a people pleaser. But the number one thing is the hard on yourself, the pressure that you put on yourself. Okay, so that is Dr. Sarno, how the whole centers the brain, how we distract. And it could take a while for us to, like when we have pain, you have to say to yourself, and he has like, you can Google this too, the 12 pain, like that, what you should say when you're having the pain. There are certain things you should say. The pain isn't going to distract me. I'm going to deal with my psychological issues. I'm going to write down. I'm going to acknowledge. The pain isn't going to stop me from doing my physical activities. I can do whatever I want, when I want. So it's interesting because Stephen Orzinich, the one who wrote the great Pain Deception, I mean, he was crawling on his knees and then hobbling, and he didn't let it stop him because Sarno said, don't let anything stop you. Just keep doing your life, and don't let it distract you. And some people need hand holding. I had a patient who had very bad pain in her buttock area and her rectum, and even to have a bowel movement was so painful for her, and to walk was so painful. And for her, she was definitely hard on herself and a people pleaser. She had a normal, very healthy, happy childhood. And for her, we got to the issue of that she realized her daughter always wanted her to come Motzi Shabbat to watch her children. And she had to travel like a good 40 minutes, Motzi Shabbos. And her daughter never said thank you, never, like she just expected it. And that unconsciously made her really angry. And once she acknowledged that, so it could be like something like that. It's as simple as that. She acknowledged that was the end of it, gone, completely gone. But I had to like, until she got to that particular specific place in her brain that was causing her this pain, she needed hands. She was really worried about the pain and she kept getting distracted and getting distracted. It's the distraction is also about timing. The pain, you're on a vicious cycle. Like you notice, oh wow, the pain. You really get into that distraction. Like the pain is worse in the morning when I get up. I wonder what I should do in the morning. Maybe I need to bend my knees, put more pillows under, or maybe I need to get up in the middle of the night and walk a little and go back to, and you're just so focused on when the pain is, or it's worse when I go on the treadmill, or it's worse at night before I go to sleep, or it's worse every time I go to work and I'm sitting in my chair. Maybe the chair is just not right. It's not the right kind of chair for me. And you just keep focusing on the physical, and you have to retrain your mind to get out of that place, to get into your head. So now what we're going to do, we're going to switch it a little bit and we're going to go on. I'm going to just tell you a few cases that I had that were really interesting cases. I had so many, I can go on and on. Let's see, it is 10 after 9. Okay, fine, I have a few minutes and then I'll talk about relationships. So I had one case, let me go here. Who do I want to do first? Where are you? Okay. All right, so one of them was, her name was Lois, and she had lost about 30 pounds. She couldn't eat anything. She came into my practice saying, I don't know, I can't eat. I have reflux, I have back pain. And I started to ask her history, what's going on. So she told me before that, I had really bad low back pain. And I went to this doctor and he was able to do laser on the disc. And then that pain went away. And then I started to get pain. I was getting like every time I ate fatty foods, I was getting pain in my upper right quadrant. What would you say that, doctor? I'm saying in my right side, upper right side. And I was like severe and excruciating. The doctors did chemistry tests and her enzymes were normal. Her gallbladder and liver enzymes were normal. And then they did a gallbladder contraction test with ultrasound to see how the gallbladder functioned. And they said that it's a dysfunctional gallbladder. It's not functioning properly. It's not contracting properly. So that was what they diagnosed. They said, we have to take your gallbladder out. So they took her gallbladder out. Now she's having pain in her back between her shoulder blades, severe back between her shoulder blades and a little bit lower, like terrible, excruciating. And they said one of her liver, not, they weren't really sure, but they thought maybe it was her pancreas. So they gave her digestive enzymes. She's still in a lot of pain right between the shoulder blade. And then I started to ask her, like her stressors. So her stressor, she had a very abusive husband that she left. So that was one stressor, and a son who she wasn't talking to. So those are two big stressors. She never really dealt with the marriage as far as the unconscious rage. And she also worked in a bakery she was a part owner of, and she would get up at 5 in the morning or 4 in the morning and have to bake every day. And she had a lot of muscle pain. She had fibromyalgia, and she's pushing herself and pushing herself. And finally doing this Dr. Sarno work and realizing that she's so hard on herself, that she's trying to please her husband and help in the bakery, that, her son and her with all this conflict. And sure enough, her pain completely vanished and went away. She was able to gain her weight back. She was a happy camper, thank God. So that was one. Oh my God, I have so many. I'm just pulling them out of the hat right now. Another one, good friend of mine actually, he had low back pain with radiating pain down the side and front of his leg to the top of his feet. And he also had a foot drop. So when he walked, his foot would drag. And he had gone, of course, to get an MRI. He was evaluated. They did an MRI. He had 3 disc herniations. He had nerve blocks. He had physical therapy. He had multiple nerve blocks. Nothing was working. And then I said to him, who's a friend, I'm like, he was a very sweet, kind person. I said, "Are you hard on yourself?" He's like, "Yeah." I'm like, "Do you like to please others?" "Yeah." I said, "You got to read Dr. Sarno's book. Just read his book." So he called me up. He says, "This is me. This book is about me." Because I'm going to go see Dr. Sarno. He was live then. And he went to Rusk Institute. He saw him. He went to the lecture. He walked out of there without his foot dropping and without pain. So, oh my God, this is crazy. And then he went to they had support groups, and he went to a few support groups, and he said, "Oh my God, I'm completely fine." And whenever he would get a twinge, it would go to his low back, a twinge of pain, he had audio. By the way, Dr. Sarno has audios as well. So he would listen to Dr. Sarno on audio, 10 minutes, and that was the end of the pain. So there you go again. This is real pain. Like I said, it's coming from lack of oxygen, but it was his ego and his id, his consciousness, his unconsciousness in battle. I had another patient who was diagnosed with kidney cancer. And he came in like complaining of like irritable bowel and diarrhea. And I said, and I knew these people, like they were in my life for a long time as far as me treating them as an osteopath. And by the way, you have to know, I'm an osteopath and a family doctor. So as an osteopath, we learn structure governs function. So we're very mechanically oriented. And for us, it's even harder to keep an open mind to the Sarno approach because we're so into how structure and function are interrelated. And sometimes osteopathy is amazing. If there's any kind of trauma or an acute injury, it works wonders. But this chronic pain with this whole pattern of people pleasing and hard on yourself, then you have to, and nothing's helping, then I have to go on with these patients and give them the Sarno approach. So anyway, this guy, I said, "Dennis," I said, you have kidney cancer and you're so nonchalant about it. Doesn't that upset you? Isn't that like you're not completely like unreactive?" He's like, "Yeah, I'm okay. I'm all right." I said, "Listen to me. I want you to go home and write." I'm laughing because he was a funny guy. I want you to write down what's stressing you, what's upsetting you, and everything, just everything. And I told him to divide the pages. That guy, I told you 20 minutes, 20 to 40 minutes a day, and then go on with your life. This guy sat there for 2 days yelling and raging and getting everything out. And that was the end of the irritable bowel. And he says, "You're right. I am deathly fearful of having kidney cancer and needing surgery. Of course I'm fearful, but but I was too scared to deal with it, to acknowledge it." So anyway, he got better completely. And thank God he's still alive today. He's fine. So that was another patient. Oh my God, I have so many. If we run out of time, no, I have to go on to the pathology. Let me think of another one that's really fascinating. There's another guy. Okay, this was a rabbi. So this rabbi had neck pain severe neck pain radiating down his arm into his hand, numbness, tingling. He couldn't even hold his head up. He would wear this neck brace around him. And of course, he had the standard. It showed, his x-ray showed osteophytes, it showed osteoarthritis, degenerative changes, some disc herniations. Actually went to see Christopher Reeve's surgeon, neurosurgeon, and this neurosurgeon said, you have a 50-50 chance that I can help you. Not so good. Neck surgery is pretty intense surgery. So to say 50-50, if the guy said 90-10, okay, fine. But 50-50 is not so good. So he had done everything, physical therapy, acupuncture, magnets, you name it, he did it. And I told him about Dr. Sarno's book. I told him, and I gave him books, and I gave him what to read, and I gave him tapes, and I explained it, and he was in denial, like he didn't want to go there. And then after 2 years of him battling with this, his wife comes to me and says, we're going to take him to Dr. Sarno ourselves, me and his father. So his father and the wife dragged him to Dr. Sarno, and Dr. Sarno asked the questions, are you hard on yourself? He said, no. Are you people pleaser? No. And his wife was there going, what are you talking about? People till 2, 3 in the morning and they call for the most ridiculous questions, and then they shouldn't be waking you up at that time, and on. And then he's like, all right, I guess so. And he did the work, and 6 weeks later, he was better. So these are the stories. And that's why these doctors who are involved in it, we were all Sarno patients. We all came from that place, and we want to spread the word because we really got better. It's not like you get half better, you get better. So it's exciting work. And since he passed away, he's actually, before he passed away, he created a documentary, and it's called alltheragedoc.com. So it's alltheragedoc.com. And it's $5 to rent it on Amazon or Vimeo. And it's an excellent documentary about a man who's suffering from severe low back pain where he can't get off the floor, and his whole story. And then they talk about famous people in the documentary who suffered, and they tell how they completely got better. So it's like very credible people who got better. And also you will see this a lot in people with very high like responsible professions, whether they're the head of a yeshiva or they're doctors or lawyers or people who have a lot of responsibility in their lives. These people are more prone to it, of course. I think that is my stories, and I have many more. I just want to let you know that if you want to WhatsApp me, if you have any questions, you can WhatsApp me. My WhatsApp number is 058-742-5664. That's my WhatsApp number. And if you Google it, if you go drbarbara.com, so DOCTOR Barbara.com, you can see my website. You can order the book, bought my book on Amazon or Kindle. And like I said, I'm more than happy to answer your WhatsApps if you have any particular questions. I'm more than happy to help. And the last part of this lecture is really on relationships, which, how does it affect relationships? So obviously, if somebody's in chronic pain, they're miserable. They're withdrawn. They don't want to deal with you, the partner. They don't want to deal with anyone. They just want to be out of pain. And it's very isolating for that person. And then they can get more and more like depressed and anxious. By the way, 40 to 60% of people who have pain suffer from anxiety or depression. So pain and anxiety, depression go hand in hand. So again, if they're blocking emotions, they're going to go into this. And we say depression is anger turned inward. When you have anger turned inward, you get depressed or anxious. So again, it's the same type of thing. You've gotta acknowledge the anger, you've got to feel it, etc. You don't always have to feel it. Sometimes it's just acknowledging it. We're all different with our history, our foundation, our growing up. So again, these people who are suffering, they don't want to do anything. They don't want to share activities. They just want to be left alone. So intimacy is affected. They're very focused on their pain and they're worrying. So the other person, the other partner is stressed out because they have another burden on their hands, like this other person who's hopeless and tense and in conflict. And the other person, their partner, has to take that on in a sense. They don't have to take it on, but they feel burdened by it, that they have to take care of them, help them, whatever it is. If they're flat on their back, they need food, they need help with getting up. So it's a burden, and they can feel resentful. The partner can get resentful because they don't have their freedom anymore. And the other person, the one who's in pain, feels misunderstood because the other one is not getting it. And so it's tough stuff. It's really, really can affect the dynamics of a relationship. And it's important to try to help these people. And even if you're fine and you're watching this today and you know somebody who could benefit, of course, giving advice to people when they don't want to hear it is not always so easy. It's hard to give advice to others unless they want to hear it. But maybe they do want to hear it. Maybe if you mention it to them, maybe they're like, oh, wow, really? I'll get this book. Oh, wow, really? And sometimes it takes time. Sometimes they read the book, like that rabbi who took 2 years. And sometimes it's like they put two and two together. They had a friend who got better. They read the book, whatever it is, and they're just done. They're burnt out with the pain already, and they're desperate that you may help them and save them by just saying a few words. Anyone has any questions? It's time for questions and answers. I'm more than happy to answer any questions right now. If you just go on Dr. Sarno, I think he has a site actually that has therapists in different locations.
And you have a validation from someone that she suffered from severe headaches 10 years ago and was cured by reading Mind Body prescription, and it was a miracle recovery. So
Yeah.
you have a cheerleader in the audience besides me.
It's awesome. No, really, it's miraculous stuff. It really is.
Do you find, speaking of relationships and the partner, the dynamics of when this pain hits in terms of the relationship, and so that to trying to be part of the supportive spouse and not to essentially cause more damage by denigrating the chronic pain, because by definition chronic is a miserable sentence until somebody really can address it.
By the way, chronic is more than 3 months or more is chronic. Some people say 6 months or more, but if you're suffering for 3 months or more and you've done everything, then it's time to move on.
But I think that the question is between a couple who basically can believe the Sarno will help. I think that it takes an education on both parts of the couple to be on board with the diagnosis. And that's why I think the education process is really something that it involves the spouse partner, because otherwise it is a credibility jump to think that, oh, I can be cured by a book. And so I think that's something that really has to be an understanding between the couple, that it can't be just a solo journey, because there's just too much of the education being the solution. And I think both have to buy into it.
Yeah, you're right. You're absolutely right. I have a couple that I'm working with now where they're newly married, and the woman has a lot on her plate dealing with her parents, and he has back pain now because he's not financially where he should be according to her, and now he's got this pain because he feels like pressure, a lot of pressure because she's like, how come you're not making money? How come you're not this? How come and the more pressure you put on the other person, the worse that they're just going to withdraw and get worse. They're going to go more into pain unless they acknowledge and they understand Sarno. So this person I'm working with to try to say, because his pain came from stress. He clearly came from stress. He had all the medical workup. And he says, yeah, I'm stressed. I'm stressed. I feel stressed. I want to please. I want to make her happy, but I'm in pain. And there's a war right now in Israel. And the work that I have is limited. And of course, I want to make a living, of course. And the other person is putting pressure. So it's as the partner, you need to back off a little bit. You have to back off the pressure, because if you know that person is a people pleaser and they want to be good and try good and they're that type of person, the more pressure you put on them, the more pain they're going to go into. Number one for the partner is to understand, to really be sensitive to them as that they're hard on themselves as it is. And if you keep putting pressure on them, then they're just going to go into more and more pain unless they start acknowledging what's going on. And yeah, you have to work as a team.
There are two questions. One, is there a site that lists the providers? Is that Sarno Clinic site actually gives a list of providers?
There probably is. I would think there is. I know that there's, if I Google right now, providers, they have so many things out there now. You could just, you could either Google it or go on AI. So Israel, there is definitely Sarno in Israel. I help people with Sarno issues. I know there was a woman who, this is a person who speaks Amir Savani. You could just Google and you'll see stuff. There's another woman, Tova Goldfein, who's a chiropractor. Yeah, it goes on and on. Sarit Shir, she's a healing coach. So yeah, there's many here in Israel. Just so you know, the book is in 8 languages. And then if you Google in America, just say Dr. Sarno providers, you're going to see, again, from therapists to coaches to physicians. And the first step is to rule out anything medical going on. That's number one. Anything, tumors, or God forbid, or any structural abnormalities, stenosis. Again, the disc pressing on the spinal cord, that's an immediate problem. A stenosis that it's so bad it's pressing on the cord and that it's more than mild. So you need a good thorough medical workup first. And then once that's done, you can move on.
Also, there was a question about the fact or statement that insurance is not covering the maintenance of chronic pain. So I think that's an issue relative to people that need the additional insurance protection. Right. And I think that's essentially.
Right. In Israel, you can get private insurance, which is it's not expensive at all. And if you get private insurance and you don't have a pre-existing condition, they'll cover a private visit as long as they get a receipt from you. So that's a wonderful thing. In America, it's a hard situation.
I am a living testimony. Actually, ironically, before this lecture, I started experiencing the back pain again. It was almost like Pavlovian going, okay. And so that I knew exactly what to do. So I went, wow, it was like the next morning, like this, it was like I knew exactly what to do because of your help. So I'm a walking advertisement, by the way. Doctor.
I am
no,
too.
but I'm talking about for you. I'm not talking about
just for. But I'm an advertisement for Sarno, yeah, because it helped me so much too. So and so many of I have patients who are physical therapists. I have a chiropractor, a physical therapist, and an osteopath who are patients of mine. And again, structure and function, that's their focus is structural. And they had to get out of that, but all 3 of those people are open-minded. So they had to get out of that mindset to heal themselves, to do the Sarno work. And all of them just had to read the book, really. And
that's what it comes down to. So I want to just grab a few minutes, first of all, to thank you for an enlightening, just sitting here listening, going, yes, this is perfect. So thank you so much for being a part of our journey and on behalf of our nonprofit. I do want to mention very quickly that we do have an exciting continuation of another webinar about relationships that Together Forever. And to mark your calendar for May 27th, this couple wrote a fabulous book. I couldn't put it down. Together Forever, Tourist Strategies to Make Marriage Work. We'll be sending out the invitation. And also, we want to hear from you. We have a very 3-minute survey. We just want to know, what can we do to make your relationships better, and that we really reach out to all sorts of trauma and whatever can help our relationships. Please access the survey and give us feedback. Also, we're on LinkedIn, Instagram, YouTube channel, Facebook. We have a beautiful website. And so we really want to hear from you and connect. But most of all, thank you all for coming and taking the time. And go Sarno.
Yeah, go Sarno.
Thank you. And thank you again.